Just before the summer started, I heard from an old professor of mine with whom I did my Ph.D. about 40 years ago. He was living with his daughter in East Coast, and I heard that his grandson, who was admitted to a top Ivy League medical school and who was in the final semester of his undergrad, committed suicide because his father got into an accident and he needed a kidney transplant, and his brother is mentally disabled. He just couldn't take the pressure. The kind of organizations that I have been working with, whether it is North-South Foundation, where we work with a large number of Indian American students who are competing with spelling bee and all kinds of competitions. One of the biggest things that we have been facing recently is youth having mental health issues. Large number of mental health issues that is preventing them from either going to the Ivy League schools they got admission to, but they do not feel they have the capability to go to those schools anymore, or there are a few cases of attempts for suicide and some of them even succeeded. This is not just the situation with youth. Many of us are going through large number of mental health issues, and the mental health crisis has become really big. Cause of mental health crisis has become so much that globally the suicide has become the second leading cause of death for youth. Whether you talk about 10 through 14, really young, not even high school many times, and 25 to 34, that means people who have joined the jobs and they are experiencing the first role, they are not able to cope up with the mental pressures. 90% of the American adults believe that the United States is facing a major mental health crisis, but that is not something that we talk about. It is like the elephant in the room. And finally, the prevalence of anxiety and depression has increased 25% globally by 2020. The number of prescriptions that are being written is enormous. I was told between 1/3 to half of population in the Western countries are under medication at one time or another. So if we look at the global healthcare landscape, it feels like we are going through a perfect storm. The perfect storm is because of the economic uncertainty that we face and the social isolation thanks to COVID, and after COVID, people are working from home sometimes, but people are hybrid work and people have moved from one place to another. There is a large amount of disruption that is also creating a headache. And the healthcare system is under constant strain. So because of all of that, if you look at the youth are the one that are first facing the major issue. 50% of youth are reportedly having anxiety and depression symptoms last year, 2023. This is the most recent thing which we talk about. And 31% increase in the mental health related emergency department visits. And finally, mental health conditions are projected to cost global economy $16 trillion by 2030. So we are not just facing a health crisis, we are facing an economic disaster waiting to happen. So how does the bringing Indic wisdom and the Western wisdom, if we try to bring it together, how do we address that? The two major effects that you can see is, one is the emotional resilience, which is needed. Resilience is something, and you fail and learn from it. Over a period of time, you learn how to manage failures a lot better than other people. Like somebody said, IQ will get you a job, But EQ is the one that will keep you in the job, and EQ will be the one which will promote you to get to a higher place. So the true strength for anybody comes from within. That is one of the major insights that one can learn from the Indic approach and the inner presence. Like everybody talks about, like I was talking to Veena a little while ago, she was saying there are large number of Indian women who are in the mid-level or almost executive level, but they have a glass ceiling. They are not able to become the senior executives because they don't have executive presence. So executive presence that is taught from the Western perspective starts with how you look, how you dress, whether you meet the eyes, whether you speak clearly. All those are what you might call the outcome oriented. But if you really look at how do you develop inner confidence, self-acceptance, certain tapping into the strengths from within, that only happens if you can learn to deal with your emotions and keep them in check, not just react. All of them begin with, do we have emotional control? Do we have emotional resilience? And if we want to actually become successful as leaders and recognized as leaders, we need to bring consciousness, not just deal with intelligence. The intelligent models, the AI models, are all coming from what you might call taking the computer to imitate the human brain. But all of us know the brain-based models are very, very limited because it deals with intellect, pattern matching approach. That's why it can predict what is the next word, what is the next sentence that you are going to say in the intelligence, in the AI, but what you are and who you are is much bigger than that, and you need to be able to tap into that consciousness, and that part of who you are as intelligence that comes to and that needs to be looked at from the perspective of transforming your inner state of the mind, inner state of consciousness, to be able to come from a place of strength. That's the reason why, for example, the Bhagavad Gita which you talk about is probably one of the most important mental health textbooks, if you want to call it. Because the greatest warrior, Arjuna, literally freezes on the war about to begin, and he just doesn't know what to do. And the whole text of Bhagavad Gita, 700 slokas, are about teaching him to develop the mental resilience so that he can win the war. And the same thing, you have something called a Yoga Vasistha, which is about developing, for Rama to have clarity about what needs to be done. So many of the programs that the Yoga Bharati offers and many of the other organizations which are here, they integrate the breathing techniques, yoga to make the body resilient and work with, and to be able to be flexible to do what you want to do day in and day out, are not just about what you can from outside, but many of them are connected to your emotional intelligence, your body intelligence. How do you tap into, in a way that you can meditate, you can do some yoga, you can do some pranayama, and in such a way you can improve the medical health. To improve the mental health, you also need to develop something called emotional resilience techniques. Google, which is not too far away, has developed a program called Search Within Yourself, based on some of the emotional intelligence and meditation and some of these techniques. It has become so popular that 15,000 or more Googlers have taken the program. Now they have created a Search Within Yourself Institute, and many Silicon Valley companies are actually beginning to look at that. These are one approach. The second approach from a lot of doctors today about Ayurveda. The Ayurveda talks about 3 doshas. Essentially, they are like humors in the body called Vata, Pitta and Kapha, and 3 gunas which are Rajasic, Sattvic and Tamasic. Some are related to the body, some are related to the mind. And in a book called Charaka Samhita, there is an entire chapter about 16 types of personality. Why am I bringing this up? Mental health, according to the Western approach, especially when it is pharmacological, when you look at medicines, it doesn't take into account different personalities, different types of people. Essentially, in the Charaka Samhita, Ayurveda approach, they identify the type of personality that you are and the type of tendencies you have physically and mentally, and then identify the particular kind of treatment that will suit you. By the way, the kind of high trauma that we are experiencing right now, the perfect storm we talked about, it affects all of them. For example, even people who have a lot of emotional resilience will get disturbed by the kind of COVID and the economic situations and all of them. The sattvic people become more Rajasic people become more tamasic. So there are different kinds of personality shifts that come about. Those are not diagnosable by the Western treatments. So we have to bring a combination, the integral approach to both Indian and Western if we want to do anything meaningful. There is a Western doctor, a rheumatologist called Dr. Gopal Basist in Orlando, Florida. When he went through the cardiac situation, he realized that he needs to develop the Indian approaches to combine with the Western approaches that he had been practicing for 50 years. And he went back to India. He got the Charaka Samhita to be rewritten for the Western physicians. So there is a Charaka wiki called Charaka Samhita online that any of you can go and you can do research. The Western doctors can work and look at how these are combined, and then you can do variety of things which are connected with that. Another interesting point about healthcare, especially the mental health that we are talking about, is the variations in the perspectives. Like in African situation, they go to a shaman for mental health issues. They don't go to a medical doctor. You know what is interesting? In Indians, majority of Indians do not believe in mental health issues. As a matter of fact, if there are mental health issues, those are considered to be a major stigma. There are very few people who go to therapists, very few people go to psychiatrists. They do not get treated. So they assume somehow we will grow out of our mental issues. And essentially, we do not talk to other people. If our kids are having high stress situations, especially in the United States, the Indian American kids going through the multiple cultures and then having major issues when there are communications are broken down, when there are issues between parents and children, or younger employees and older employees, they do not know how to deal with it. They hope somehow these will all get worked out over time. It doesn't work that way. Understanding and respecting the cultural pathways is going to be crucial for critical care and for people to become whole. That is extremely important. There is a beautiful solution that I found in the healthcare, not in mental health, but for example, there was one Dr. V who created something called Arvind Eye Hospital. Interestingly, he retired at the age of 58, but he decided that he was too young to retire, and he convinced his sister to convert their parental house, a 4-bedroom house, into a 11-bed eye care hospital in Madurai in 1970s. Now that is the largest eye care in the world. The Arvind Eye Care Hospital essentially deals with over 10 times the British population deals with at 1/100th the cost that the UK spends on eye care. And for example, the cataract surgery, some of them, they were able to, Western cataract lenses, intraocular lenses they are called, they got them from United States. They are what you call manufacturing them in India and selling it for $2 instead of $200. So the idea is there is a lot that they came up with. You know what is very interesting? When Dr. V came to United States, and in some situation he had to go to McDonald's, he saw these high school students actually doing all the stuff and providing a certain kinds of things. And he said, eye care should be provided like this. And then he presented in Harvard. Everybody laughed at him. If you are going to look at McDonald's as an example to take from United States to provide your health care, I have a feeling yours will be worse. Nobody can actually pay any attention to that. But interestingly, 40 years later, even though Dr. V had passed away almost 20 years ago, people from John Hopkins, from Harvard, everywhere else, if they want to study the best eye care, they go to India and they study at Arvind Eye Care Hospital. So what can we learn from that about for the TALHospitals and for everything which we do? Number one, combine the traditional wisdom with the modern practices. Integrative approach is the only way to go if we want to really deal with healthcare crisis that is coming up. Second, innovative service delivery models like what is being proposed, just like a Uber that does not have a single car, they became one of the leading providers of transportation solutions, just like a Airbnb, which doesn't own any hotels, is valued much, much more than Marriott, Hilton, Hyatt, all of their value combined together. We need to create a platform for healthcare that addresses different people to do different things, and which is what actually Sai and Veena have invited us to look at the TALHospitals model. Finally, we need to focus on accessibility and affordability. Several times, when you go from here to various other countries and do the medical tourism, it might make it much easier to work with both systems to be able to deal with it. Actually, Mutual of Omaha and some of the other people have worked with some of the doctors for health care for heart patients to go and have their heart care, some other parts, and the insurance still covers it. So there are ways in which we can do multi-country collaboration to work with this kinds of situation. We need a new paradigm for global mental health and of course the regular health also. So the integrated approach combining Western psychiatric approaches with the traditional healing practices is probably the best way to deal with the crisis that we are facing with the human beings. And the most important part of it is, how do we leverage the Western technology with accessibility that is available globally, because the global digital mental health market is supposed to grow at the compound annual growth rate of 20% from 2021 to 2028. So this is a great growing opportunity. So if we can look at this very, very differently, it will be very powerful. I have a friend, a Nobel laureate called Leland Hartwell. He got a Nobel Prize in 2001, and he was the head of Fred Hutchinson Cancer Hospital. When I used to work with him, he used to tell me that if you look at the oncology, if you look at some of the therapeutic approaches and effectiveness of chemotherapy, in the 50 years that he had practiced, he was telling the efficacy of it went from 30% to 40%. So the key thing what he realized was, you need to really do personalized care. So when he retired from there, he went into University of Arizona to look at personalized care, and now he is not only working with the University of Arizona, he is also working with Amrita University, trying to integrate meditation, integrating yoga, integrating various stuff in that. Prevention and early intervention is the best way. So there is a lot that can be done in this. So let me take it to the final thing. If you name the elephant in the room, it is the mental health. We talk about a lot of things, but we don't talk about mental health. So my sense is, you might want to think about how many of you are overwhelmed today. How many of you are anxious and depressed? How many of you have got major conflicts? But on the other hand, while you are on medication, it is great. But how many of you have seen a therapist? How many of you do meditation? How many of you do yoga and pranayama? This is because ultimately it comes down to one call for action I want to leave you with is doctors, embrace the cultural competence to your practice. Look at integrative health practices. IT professionals, become pioneers in creating the culturally empathetic mental health technology that save millions, like what you are doing today. And political leaders advocate for policies that recognize mental health as a global priority. And finally, Silicon Valley leaders invest in innovative, culturally sensitive mental health solutions. It is not just a challenge, it's an opportunity to reimagine how we care for each other. And thank you very much for that.